My preferred graft to reconstruct ACLs is an ACL graft using a quadriceps tendon. That's the middle third of your quadriceps tendon. And I really see great results with that. Patients seem to do wonderful, and I really trust this graft. Leah had one done about 8 or 9 months ago, and she's done really well, and I'll let her tell her story.
I had ACL reconstruction, and that was 8 months ago. So the surgery I was pretty well prepared for. It was simple, it was painless. I was really fortunate to have really great nurses around me, great support at home. Afterwards, it was harder than I thought it was going to be at first. I had previous surgeries, so I thought I was really prepared. I took pain pills maybe a couple of weeks, if I can remember right. And I limped. How long did I limp? Maybe 3 weeks? I'm doing well. I'm doing really well, actually. I'm back to running. I'm lifting weights. So I'm almost 100%.